Good morning from Uganda, and good afternoon, good evening from wherever you are logged in from. I am called Obungoloch from Barara University of Science and Technology here in Uganda, and I am glad to be part of this virtual workshop to give closing remarks. And I will also talk briefly on some of the strategies to overcome the challenges of MRI technology in Africa and low resource settings, for instance. And these might be some of the things I think of. But I want to thank the Smart Africa Network for organizing this virtual workshop and give access to a global audience. I also equally want to appreciate the other partners of the workshop and our expert speakers and the attendees as well, even those that I have not been able to list here. I thank you and we appreciate your partnership. Talking about MRI technology, sometimes we associate relatively poor images with low cost, but when MRI technology started, the first human image is accredited to Raymond Damadian, who is one of the fathers of MRI technology. That MRI system was low field, but as of low cost, I don't think it was that low cost, because as I gather, the magnet was made out of about 30 miles of niobium titanium wire, which is a superconductor basically, and it was cryo-cooled as well with helium. It weighed a ton plus, so it was not really that low cost. So as you can see, the MRI started with its challenges right from the beginning, and these are the challenges of cost. In the end, when it was perfected, I think one of the questions that was being answered was like, forget about the question of the costs, make a working device. So the device was finally perfected to qualities that probably I have not revealed here, way more than what I can show now. But the question of the cost then became an issue. And as you can see now, after the technology has been perfected, they say for you to have that technology, you need the superconductors, you need shielding, you need cryogens. In other words, you basically need deep pockets to be able to find the technology in terms of equipment itself. When it comes to infrastructure, you need a very good facility, you need reliable power supplies, you need good internet connectivity, you need a way of archiving the information or the images that you're acquiring. And in a way, you need deep pockets to be able to do that as well. When it comes to in terms of expertise for operation and maintenance, you need very highly skilled radiographers, radiologists, physicists, and those who supply you supplies. The engineers need to be highly trained, and they should have very good tools. The administrators that oversee the usage of this MRI system have to also be those of relatively high caliber. So you can see that to maintain these people, you also need deep pockets. So the question of MRI really surrounds the deep pockets that you are required to have to host the system. And as you can see in the global density of MRI systems, which slide I have used several times, but you see that countries without deep pockets have very limited access to MRI systems. Yet at the same time, those are the countries that have what I would call the greatest need for MRI technology. We are the ones that have hydrocephalus and many other diseases that debilitate our young people and ourselves. We are now very high in terms of road accidents and traffic accidents. For instance, in Uganda, it was reported that up to about 23,000 road accidents happened in 2023. So we end up with broken limbs and cracked heads and things like that. Things that need MRI to help us to image. When you go into malnutrition, you know where we lie also as Africa. Very many of our young children are malnourished. These children later go on and revive themselves physically, but the mental revitalization, we don't know how it happens. So also we need MRI to be able to do some of this. If you look at mental health, for instance, there was one of our dailies in Uganda reported in 2022 that 14 million people in Uganda have mental disorders out of a population of about 49 million now. So you can see, you're talking of almost a third of the population of the people with mental health issues. And we think also MRI could also play a role in trying to tackle this kind of problem. So you see that we have very diverse challenges that really need MRI, and to overcome some of these challenges also needs a multifaceted approach that will involve governments and policies, charitable organizations that and development partners that donate this equipment and devices to us, because we don't have deep pockets, but we have friends that have deep pockets, and sometimes they give us these things. But then we have ended up realizing that it is not only about having the deep pockets. The systems have to run. Sometimes we don't have those systems running in Africa here. The device manufacturers and vendors, for instance, we need their participation in this. We need healthcare managers, for instance, that also will have to manage these devices that we put here. Academic and research institutions are needed, because this is where we have very highly skilled people in such places to have to make sure that the systems are operated, they are maintained, they are used well for research purposes. And then, of course, the scientists and the innovators and the engineers. These are all needed in order to tackle these challenges of MRI technology. And currently there are some efforts of this. If you look at Uganda, for instance, there has been an effort to increase access to electricity. For instance, now in urban areas, we said the electricity coverage is about 57%, but in rural areas it's still about 10%. So you can see that maybe now in many of our urban areas could be ready for MRI systems in terms of power or energy. But of course, the quality of that power also matters in a way, and the stability of the power. The government are also trying to deliberately put an effort in acquiring MR systems. For instance, now our government has a plan to acquire MR systems across the 14 regional referral hospitals, and also some of the specialized healthcare facilities like the Uganda Heart Institute, the Uganda Cancer Institute, and the rest of it. And I'm sure that a number of governments across Africa have similar efforts to try and acquire these MRI systems. The training efforts, for instance, when we talked about one of the challenges of MRI earlier, we talked about the need for highly specialized personnel. When you look at the biomedical engineering training, for instance, the medical physicists in Uganda here, this started just around 2011 or 2010 there, so it was not long ago. But now we see that there is some training going on, and some of these trainings are also tackling aspects of MRI technology. The radiologists and radiographers, for instance, these are also being trained. A few years back, they reported that Uganda only had about 37 radiologists across the country. But this has now improved. These records have increased a little bit, and there is now relatively more than 37 radiologists, but still these are stationed around Kampala in the capital city. And this, I think, is similar to many African countries as well, where many of your radiologists and highly skilled personnel are within the capital cities of the countries. Also, that is where the devices are. But there is an effort in trying to train some of these radiologists. Some MRI systems are adopting the teleradiology approach to try and minimize the challenges of skilled personnel. I know a center in Kampala that is run by one of our very senior radiologists in the country that takes advantage of this radiology, where some of the radiologists are stationed abroad and can help with interpretation of images. So there are some efforts in there as well. And of course, recently, many of us that has brought this, even this workshop together, we have been forming some of the research groups, scientific societies that are targeting specifically aspects of MRI. The Smart Africa Network that has organized this workshop is one of them, has carried out workshops now in Uganda, in Ghana, and the next one will be in Tanzania. The Camera Network has also done a lot. It's training a number of people across Africa on image enhancement, image processing, AI, in MRI. And of course, the African chapter of the ISMRM that has now links to the global ISMRM network and has, which has a wealth of expertise in MRI, and some of you are here giving back, doing what I would call social corporate responsibility, giving your knowledge and expertise to the rest of the people in Africa who do not have that kind of expertise. So these are some of the efforts that are also being performed to overcome some of the challenges of MRI technology. And of course, the mentorship and scholarship programs. The Smart Africa Network, again supported by the CZI scholarship, has offered so far 2 rounds of scholarships to young scientists, again focusing on MRI. ISMRT has a Future Leaders program which is going extremely well, and across Africa there are members that are affiliated to this organization that are benefiting a lot from the mentorship of the senior people in the ISMRT community. There is the Medical Artificial Intelligence Laboratory that has been set again by one of the senior members of the ISMRM community and also the African chapter. This has been set up in Nigeria, and again is training a lot of people across Africa, including Uganda, Rwanda, and a number of other African countries that are involved in this network, and they are remotely processing images and learning how to use AI to process images, which are archived in the My Lab in Nigeria. So I want to thank all the initiatives that are being put across to help us overcome some of the challenges that are making us fail to access the MRI. And of course, recently there has been a move or a push towards appropriate MRI technology, what we would call the ultra low field or portable MRI technologies. And of course, Hyperfine is one of the front runners of this. A number of you have now interacted with the Hyperfine systems, and we have a few now in Uganda. I think about 3 units already in Uganda here, and a number of African countries, especially supported by the Bill and Melinda Gates Foundation, have been able to access these portable MR systems. And of course, other systems are also being developed. Over in LUMC, you see that they are looking at how can LUMC, for instance, make this indispensable technology affordable for the rest of the world. So people are now looking at the aspects of costs, not only the quality of the images or the best technology that is outside there. And over in Europe, you have physio MRI that has also been recognized by the Innovation Council as one of the top 5 technological projects in the European Union. So this is, I think, over in Spain, where this technology is being developed. So there is effort to develop very low-field technology. And those of you who are in Singapore, a few months ago, you probably were able to see the presentations of Ed Wu over from China about the low-field efforts that are being pioneered there. And of course the Embrace technology for babies over in Israel, I think, where this technology is also being developed. So there are efforts to try and reduce the cost and overcome the challenges of the MRI technology. And this also covers the aspects of power, because when you see most of these low-field MR systems now, they do not need very high power. Some of them are being tried to operate on the batteries, that even if power goes, you might be able to run on a battery at least to complete a scan that you have already started, as power is one of our major challenges in Africa. So as I conclude, I just want to say that as we work together, I think that we are soon reaching a critical mass to put out a technology that truly answers the question of access to Africa. And I think when we work together, this is now a technology that really has a potential for low cost. Many of the technologies that we have seen, the high field systems, for instance, we were talking of deep pockets, but we think that there's a potential now to lower some of these costs to a level where you no longer need deep pockets to be able to access an MR system. So I think that if we work together with all the partners who are here and those who are not here, we are truly moving towards democratizing access to MRI technology, which is one of the pillars or divisions of the camera network. So again, I want to thank all of you who are here, and I wish you all the best. We will meet in Tanzania in next week, and we hope that we can do this physically with each and everyone present. I can't wait to see all of you in Tanzania. Thank you, and have a great day.